Thank you, everyone, for joining Wadham on our third podcast in a series on the COVID-19 crisis. We are fortunate today to have the leadership team from the National Preparedness Leadership Initiative, which is a collaborative effort of the Harvard T.H. Chan School of Public Health and Harvard's Kennedy School of Government. It was also developed in collaboration with the Centers for Disease Control and Prevention, the White House, and the Department of Homeland Security and the Department of Defense. I am privileged now to introduce Dr. Leonard Marcus, Eric McNulty, and the Honorable Richard Serino. Dr. Marcus is the founding co-director of the National Preparedness Leadership Initiative. In recent years, his research, teaching, and consultation have played a key role in national and international terrorism preparedness and emergency response. He is also the founding director of the Program for Healthcare Negotiation and Conflict Resolution at the Harvard T.H. Chan School of Public Health and serves as a lecturer on public health practice and director Program for Healthcare Negotiation and Conflict Resolution at the Harvard School of Public Health. He is considered a pioneer in the field of healthcare negotiation and conflict resolution. Eric McNulty holds an appointment as Associate Director and Program Faculty at the National Preparedness Leadership Initiative. His work centers on leadership in high-stakes, high-stress situations. He's currently working on a book based on meta-leadership, which is the core leadership framework of the NPLI curriculum. Mr. McNulty also works for the Program for Healthcare Negotiation and Conflict Resolution at the Harvard T.H. Chan School of Public Health. He is a widely published business author and researcher. He writes regular online columns for Strategy and Business and O'Reilly Media. He's also written multiple articles for the Harvard Business Review, as well as articles for Harvard Management Update, Sloan Management Review, Strategy Innovation, and Market Watch, among others. The Honorable Richard Serino spent more than 40 years of public service. During that time, he provided extensive leadership on emergency management, emergency medical, and homeland security at the local, state, federal, and international levels. Mr. Serino is currently a distinguished visiting fellow at the Harvard School of Public Health and the National Preparedness Leadership Initiative. Mr. Serino was appointed by President Obama and confirmed by the Senate as the Federal Emergency Management Agency's 8th Deputy Administrator in October 2009 and served until 2014. In this role, he also served as the Chief Operating Officer of the agency with more than $25 billion budget. Prior to his appointment as Deputy Administrator, he spent 36 years at Boston EMS, where he rose through the ranks to become Chief. He also served as the Assistant Director of the Boston Public Health Commission. Today's podcast will focus on crisis leadership during this COVID-19 pandemic. So thank you again, gentlemen, for joining us. We will now start our discussion on crisis leadership in the COVID-19 crisis. And I'd also like to say that the NPLI and our team has recently published a book called You're It, which deals with crisis leadership in times like this. So first off, can you please give us a brief overview of crisis leadership and some of the points that you teach to your students at Harvard?
Well, thank you, Greg, and thank you to Wadham for putting out this podcast. The core of what we teach is called meta-leadership, and the prefix meta means that you're looking at problems from a very, very wide perspective, and you're looking at solutions also from a very, very wide perspective. When you're coping with a novel crisis like COVID-19, and you're dealing with situations and contingencies you hadn't dealt with before, when the crisis leader is using that meta perspective, they're more likely to understand the extent of the problems that they're facing, and then also more likely to develop solutions, innovations that haven't been done before, such as the social distancing policies that we're seeing, that likewise are absolutely necessary in a crisis like this. So we call that overarching framework meta leadership. So if you have a meta-leadership view of what you're dealing with, one of the things you need to look very widely at is time and how time is evolving in this crisis. So one of the key things that we're looking at is the arc of time. Rich, could you talk briefly about that?
Sure. Thanks, Lenny. And Greg, thank you for having us all on this podcast with Wadham. One of the things is Dr. Marcus mentioned is time. Time is of an essence in the disaster response, and especially in this pandemic. As we look at the response to COVID-19, we have to remember there's a was, is, and where we will be. And for the longest time, we were in the was, with what happened over in Wuhan, China, what happened in other places. And we had time in that period to what we should be doing. The is where a lot of us are right now. And good leaders need to actually start to look at where we will be. where we are at this moment in time is in the middle of the response. The actions we can be taking, talking about how we can mitigate, how we urge people to stay home, how we need to get supplies, how we need to take care of. And those are very important things that we all have to do now. But leaders really have to start to look at what will be in 2 weeks, what will be in 2 months, and what will be in 6 months. So take this opportunity to think about this arc of time and where we're able to go, where we were, where we are now, and we will be. There will be an end to this, and leaders have to start to project out to where we will be in 2 weeks, a month, and further on. Eric, maybe you could continue on and talk a little bit about some of the emotional intelligence in leaders as a role model.
Thank you, Rich, and thank you, Greg, for having us here. If you want to lead effectively in any crisis, this crisis or any other, you have to think about two things: who you are and what you do. Who you are is your character. Are you trustworthy? Do you demonstrate integrity? And what you do you take appropriate decisions? Do you take the right actions at the right time? And central to all of that is your emotional intelligence. Are you self-aware? Are you aware of other people? Can you regulate your emotions? Can you remain calm and confident in the midst of chaos? Can you demonstrate empathy toward other people? Can you feel their pain? That's really important because you as a leader are a role model. Others are looking to you. They will mirror their behavior on those that you demonstrate. The way that you are is the way that they will be. And particularly in this crisis, because it's a long duration event, it's a real challenge. You've got to make sure that you are taking care of yourself as you take care of others, making sure that you can maintain that emotional intelligence over time. And it's really tough because we're facing a lot of stressors right now. So be thinking about the long term, be thinking about how you're going to show up. Think of a mirror in front of yourself. And each time you walk into the EOC or the OR or wherever you happen to be involved in this crisis, even your living room at home, be thinking about who are you and what are you going to do, and be as intentional about that as you can.
Thanks. That's excellent. Some great information, guys. We really do appreciate that insight. I can tell you that, WADM membership and those who come to our WADM conferences and follow us, they stretch across the globe. And many of them right now are in leadership roles during this crisis in different stages of this crisis. So some of our members are taking leadership roles now in the preparedness piece of this. Other of our members, like in Italy and elsewhere, are taking really active roles in this crisis and this response. So I would ask you, what are your opinions on the leadership skills that are needed, sort of in particular for this crisis? What are some of your take-home points as far as the crisis leadership skills that some of our members and some of the people listening to this podcast could use right now?
Sure, I'll start with that. This is Rich again. I think one of the biggest things is for leaders is to follow on with the arc of time is the capacity to anticipate. Be ready for what's coming next. We know in the United States and other parts of the world what is going to happen next with this response to the pandemic. That's unusual that we actually know what's going to happen. We may not know the exact timeline, but we know that there's going to be an end. So certain things now in the midst of this is to anticipate that one of the biggest things to get through this is going to be staff and how we're able to deal with the staff to make sure that they have time off, to make sure that they're able to, if not go home, take care of places they can go to, have hotels ready for them, because a lot are not going to want to go home. Also anticipate, as we're seeing now very much so, the need for equipment, but not just in the immediate, in the long term. What there is just PPE and ventilators, all important now, but in the future, what sort of space are we going to need for folks? Where are they going to be able to take care of these? And then also, as we start to think out further, what are the business implications? At some point, we are going to start back up, and what's going to be needed to start back up? How are they going to be able to, it's not going to be one day turn on and everything's going to be, back to normal in one day. This is going to be a gradual process, and how we prepare now for how we recover is going to determine how well and how long it takes us to recover. Now, maybe Eric, you can talk a bit about how do we communicate various parts of this, what we know and don't know.
one of the things I cannot overemphasize is how important communication is in the midst of crises. And leaders have to over communicate because as much as you think you're not doing enough. We have to make sure everyone understands what do we know and what don't we know and what are we doing to close that gap. And if you're in the medical professional, there's lots of things that you know and background and context around things about how long it takes to create a vaccine or what it's going to take to actually have your healthcare facility operating through this crunch that the general public, elected officials, others may not know. So be communicating, always looking for clarity. Be thinking about this is what we know, this is what we don't know. How are we closing the gap? And really, really important is to help people understand what they need to do. How can they contribute to moving this forward? Because you want people to be occupied, to have an idea of what their role in this is, and communicate and always be looking for clarity. It's a moving target. You have to be adjusting it just like a camera if you're in the back of a Jeep trying to focus on something. Keep adjusting that lens to keep things in focus for people so they know what's coming next. And of course, also important is this ability to lead, not just your silo, but beyond that. Lenny, it'd be great if you could talk about that for a moment.
Thank you, Eric. One of the things that we say about meta leadership is you have to lead in multiple directions. First, you have to lead down. Your subordinates, the people who call you boss, are looking to you for leadership. Then you also have to lead up. Many times you're leading to an elected official or to a boss. You're the subject matter expert, and what you need to do is to engage them appropriately. That then, in combination with what Eric just talked about, leading across to other departments, other parts of your organization, and leading beyond, so that we're truly working in a crisis like this as a system and not individual organizations or individual offices doing it their own way. In a pandemic, if we really, really want to stop the pandemic, we've got to be working together. And that's one of the key essential lessons of what you're doing as a meta leader.
So that's great, and that's a great segue into my next question, which leaders have to do all these things, the number of these different things that you described, and one of the more important ones is also to assimilate new data as it comes in a disaster or a crisis like this. Sort of look at all these unknowns, and then try to not only make decisions on that data, but also convey them to the public and elsewhere. So when the question is, when there's so much information coming from pretty much all directions, some of which is data driven, some is not, what advice do you have for leaders on how to manage this data and how to convey accurate and important information to the public?
Well, thanks, Ray. That's a really important question. And this is something very new for the general public. They're learning a lot as they go, and there's undoubtedly a lot of confusion. That confusion in and of itself is only serving to further spread the pandemic, especially when people think it's okay to go out and play sports on a field. So what's really important, and the way to get this across to the public, is to give them a very clear to-do list. So all of the instructions about washing hands, about physical distancing, all the instructions about not going out when you've got a cold or got symptoms, all of that is really, really important. So that as the meta leader is thinking about how to get everybody oriented and everybody compliant with what's necessary right now, think of it as a to-do list, make it clear, make it doable, and then encourage people with multiple messages to ensure that they keep doing it, especially as this is not going to be a short event. It's going to go on for weeks.
And let me build on that, Lenny, if I could, because I think it's really important to tell people what to do. But as a leader, it's also incredibly important to give people hope. Don't sugarcoat the present. Say this is bad. These are going to be tough times. Things are going to get worse. It's going to look awful. And we will get through it. And we have the best people in the world working on this, and we're giving them the resources they need. Give people the hope, because they have to see the other side of this. They have to see they're going to get through it. And we often, we want to give folks what to do because that keeps them occupied now, keeps them moving productively forward. We also have to keep their spirits up, their emotions up, realize there's a lot of emotional toll in this. Hope is one of the most important things you have as a leader that you can help give to people. And that leads to ultimately resilience. I think, Rich, you have some good insights on this.
Thanks, Eric. I think one of the important things is at the end of the day, the leaders have to be able to convey that we as a country, we as a globe in this case, can be resilient, and we have been resilient, and we will continue to be resilient. And one of the things that we have to look at is, as we gather all this data that's coming in, is how we can sort through that data for the important bits of information. I think leaders are able to do that. Leaders are able to sort through all this data and try to get it down to information. That people should only be listening to really trusted information, not everything that's on Facebook or on Twitter, just from the trusted sources. We're all getting bombarded with that, and the leaders have to be able to manage that. They have to demonstrate and show some of the best behaviors that people are talking about. And I think that as you're able to do that, as you start to make sense of all this vast information, that people will follow you. And I think that's one of the key parts of leadership, is how can people follow you? You have to build that trust with people. As you develop that trust with people, people will follow you. And don't underestimate something that Eric said. Don't underestimate the power of hope. And leaders at every level are ones that can give that hope.
Yeah, thank you. That's very valuable information, guys. Really appreciate that. Let's get back to our the global audience and those who are listening to this podcast right now. We see around the world, again, as I said, we see countries that are fully engaged and all in on this response right now. But we see other areas of the world that really haven't seen much yet, or in sort of that wait and see or preparedness phase. It's almost as if, the feeling in some of these places is that, we're actually seeing in some places where volumes in emergency departments and hospitals are actually going down. Maybe perhaps by, fear of going to the emergency department and catching this illness, or I'm not sure exactly what that is, but it almost feels as if in some places around the world that it's like the water receding before the tsunami comes. And that's a really tough place to be as a leader. So my question is, from a global perspective, are there any recommendations you can give to leaders in those countries that are just now seeing cases begin to rise, but expecting the surge to arrive maybe in the coming weeks?
Yeah, Greg, it's a really important question. And I think the key is, let's get smart. And one of the advantages that we have when we look at this from a global perspective is that there have been places that have experienced this pandemic. Look at what's happened with them and know that it's highly likely that it will also happen to you. So they're like your sentry. They're showing what could come next. So right now, before it hits your country, it's the time to prepare. This is a story of a smart virus that has used humans to transport it around the world against an intelligent species. And one of the questions will be, who wins? Is it the virus, or is it the intelligent species? And we're able to use that intelligence by gathering the data about what's happening before, what's happening in other countries, and then prepare your jurisdiction. And I know, Eric, you've been doing a lot of thinking about how we understand this virus and its movement.
Well, I guess I'm sort of our resident biologist, or as close to it as we get here at the MPLI. And I think one of the things to note is that in evolutionary terms, this virus has achieved a great victory in terms of its ultimate survival. When a virus can leap into have a host in the most pervasive large animal species on the planet, humans are everywhere, that's a great victory. It has now done a great job to ensure its own survival into the future. So in an us versus them, they've achieved a great victory. The virus has achieved a great victory here. And what I think it needs to do to tee up, and this is more of a long-term answer than a short-term one, is be rethinking our relationship with the wild. And that means things looking at the wildlife trade. It means looking at what areas we go into in what ways. We currently think we can sort of go anywhere, anytime, and there aren't consequences. Well, actually there are, because that interaction between humans and other species, be they plant or animal, gives the opportunity for viruses like this to make the leap and then cause enormous damage. So I think we need to be thinking about it. We do need to be planning, and we do need to be thinking right now about rapid transfer of lessons learned, because there's a lot being learned. We in the US learned from China, and Italy and Spain. Other countries are going to learn from our collective experience. Be thinking about how we can capture and rapidly transfer that information forward in a way that's useful to the next countries that are going to be hit. Rich, what are your thoughts on how people in EM need to think about this?
I think in emergency management, people really have to understand that COVID-19 has truly created a new mandate for emergency management in our work and preparedness. We're entering a stage of a new normal that leaders now must change how we're thinking and how they're thinking, what we're doing, where we're going, and specifically how they're leading. Emergency management has a unique opportunity to bring people together, to go across all the various different silos. We no longer can work in our individual silos. We have to build bridges between each one. We have to look at how we're all able to work together in meta leadership, how we're able to lead across, how we're able to bring the different silos of people together, or as one of our colleagues call them, cylinders of excellence. There's many cylinders of excellence, but everybody in their own cylinder or their own silo is not going to solve this. This is not something that any one city, any one group of people, any one hospital, any one county, state, or even one federal government is going to solve. This is where we're all going to have to come together. We are in that point in some places, as Greg eloquently said, where the water is receding before the tsunami. And now is the time to prepare for the worst. We also have to hope for the best, but in this case, it's much better to be prepared, to be ready for that tsunami of patients that's coming.
Great. Thank you so much, gentlemen. Maybe as a final question, and just sort of open up the discussion to whatever you would like to talk about, I can just say, in my experience, and I think in recent history, really, I don't think I've ever seen a disaster that is so all-encompassing as this one. And the way I'm saying that is, what I mean by that is that, there's always a healthcare component to crises and disasters like this. But what we're seeing now also is such a huge impact on the global economy. Some countries being impacted more than others. We're seeing real threats to industries. There's a lot of concern about, travel industry, airline industry, restaurant industry, et cetera, as we do this self-isolation. And we take these necessary but rather draconian measures to, try to blunt that curve. What are your thoughts on leaders who are trying to sort of traverse this landscape now that is so all-encompassing, that involves so many different sectors in such a dramatic way?
One of the there are two really unique aspects to this crisis. One of them is everybody is affected. In most major disasters, if there's a hurricane or a tornado or an earthquake, it hits one area, and then there are people on the outside who are not affected who can come in and help. In this particular crisis, everybody around the world is affected. And that's number one. And number two, and it varies from country to country, it varies from state to state, this disaster, for that reason, has become very political. And so it's important for leaders to understand the politics. And what we're finding is those leaders who are best able, especially emergency managers, subject matter experts, are doing their best to stay nonpartisan or non-political. There's a job to be done. Focus on what the job that needs to be done, and do your best to not get into the political fray. Because once you get into the political fray, you get into the good guys and the bad guys. And to the extent that those people who are subject matter experts can try and stay out of that, they will be more respected, more trusted, and then ultimately more effective in leading through this crisis.
And this is Eric. Let me build on that a bit. What I hope right now is that leaders take the opportunity to be brutally honest about the strengths and weaknesses in our healthcare system, our social system, our economic system. We're seeing things laid bare right now, and some things are going to go better than we expected, and we're going to really rise to the occasion, and that's going to be great. But we're also seeing some places where there are real, not just cracks, but some deep chasms in some of these systems. And this is the opportunity to figure out over the long term how we're going to repair those, how we're going to build on things to make them stronger, better for the future. And I also hope that we are not afraid to be aspirational right now, that we should be thinking about how can we be at our absolute best amidst this adversity, our best as individuals, as teams, as communities, as organizations. How do we take care of ourselves, but also take care of each other? And if we think of that, how do we be at our best right now? It's going to be the trigger, the impetus to think about how we improve things going forward. So the next time we hit an event like this, which hopefully isn't soon, but we're more ready for it than we were for this one. Rich?
Thanks, Eric. I think one of the, as we start to think about this crisis, is I've said for a while, never let a good crisis go to waste. And this is a crisis. There are people now who are in the middle of this, especially on the front lines in healthcare, but there are others who, at that pause, before the tsunami comes, there are others who aren't in the middle of the fray. This is a time to step back and start to think about how you can do things different. It's going to be a different world at the end of this, but how can we innovate? How can we start to think of different things we thought a month ago we would never be able to do, we're doing. So take this opportunity to where we can go, what we can do, and how we can completely change the way we do business, the way we think about disasters, not just pandemic, but how we think about life in general. So I think it's really important. And one last thing I'd like to mention is Dr. Fauci said, the virus sets the timeline. I think it's going to be the leaders that determine how we respond to this.
Rich, I couldn't agree with Lonnie. I couldn't agree more. And Dr. Fauci has been an extraordinary example of a leader in this. He said something else that I think is also a model for other people. When the United States was facing the testing crisis, he said it was a failing. And I think that as difficult as that was for his political leadership to hear and for the country to hear, it's important for leaders to acknowledge here's what's going well and here's how it's operating. And if there is a failure, you've got to confront the failure. You've got to acknowledge it and then motivate and organize people to solve that problem. Because if we go into this assuming everything's going to work perfectly, there are a lot of unknowns, as Eric said earlier, and we've got to acknowledge those failures. We've got to acknowledge those traps, and then we've got to turn around really quick and find ways to solve those problems and overcome those obstacles.
Well, that's great stuff, guys. And I really do thank you for taking your valuable time to do this podcast with us. Wadham does appreciate it. And also, we very much appreciate what MPLI does, how you support leadership, how you create leaders. We are very aware that many, if not most, of your graduates and former students are right now in leadership positions, very crucial positions, and preparing for and responding to this crisis. So we thank you for this time. We also thank you for everything that you do.
Well, Greg, let us thank you as well, because your members are out there day in and day out doing emergency medicine, disaster medicine. We appreciate you giving us the opportunity and the work that you and your members do every single day.